right.
Should we kick things off?
Yes.
Welcome, everyone. Today's event is Chocolate Milk Diaries, Real Talk with Black Moms about breastfeeding and chest feeding. I'm Grace Lewis. I am a Black mom. I'm a mother of twins. They are 2, and I breastfed them exclusively for until they were 24 months old, practically to the day. And so I'm excited to have this conversation. We're joined today by Dr. Janet Williams. Dr. J, could you briefly introduce yourself?
Yes. Good evening, everyone. My name is Dr. Janet Williams, and I am a nurse midwife for the last 18 years. I am also the founder and CEO of Transitions Women's Health Consulting, LLC, where we educate maternal health providers about recognizing bias and how it affects the care that is given to women and contributes to the high maternal mortality rates. I'm also the author of a program called Black Mothers Interrupted that addresses that same thing, but I'm educating medical students, nursing students, midwifery students, because they need to know this coming in, and all about implicit bias. So I'm so happy to be here this evening.
Thank you, Dr. J. We're also joined by Shamiesha. Shamiesha, could you introduce yourself?
Hello, everyone. My name is Shamiesha Ebhotemen. I'm a registered nurse and certified lactation educator, and I'm an IBCLC candidate as well. I am the owner of Nurse Milk, LLC, where we guide families on their lactation journey, whether that's pre or postnatal. And then I'm also the founder and executive director of a nonprofit called Her Story, Inc. It's a collaborative of BIPOC health and wellness team where we focus on creating a safe space for BIPOC birthing families in Orange County, California. And that is me.
Well, thank you, Shamiesha. Welcome, everyone. Hopefully this is an informative conversation. Please put your questions in the Q&A or in the chat. And so let's dive in. I'm going to kick it off by talking about why it's important, especially and specifically, to discuss breastfeeding and chest feeding for Black parents. And I want to start with you, Dr. J, because you shared something when we were speaking earlier that really surprised me, and I think speaks to why it's important to have this conversation.
Yes. I was a teen mom, and so when I was 18, that's the first time I had entered into a healthcare system, and it was during my pregnancy, and it was a very, very hard system to navigate. It definitely was not patient-centered at all. I felt like I was on a conveyor belt in the clinic. It was all about their rules, go stand here, get on the scale. They ask you all of the right questions, but at the same time, it was very robotic, if I could say the least. Not once during my prenatal care did I hear anything about breastfeeding. There were no classes. They didn't even mention it, nor did I ever witness anyone breastfeeding, So when I finally went into labor, I was escorted to a room. My family and my husband sat in the waiting room, and I labored alone without any support. I don't remember seeing anybody breastfeeding even in the hospital there. So once I had the baby, I was given an injection on the delivery table, but just, no one said what it was. I remember getting stuck, and that was it. They did basically treatments and procedures on you, and without any explanation. And just when I was being discharged, my nurse said to me, "Oh, you were given an injection to drop your breast milk, so you don't have to worry about it." And it was like, what? That was the first time I heard the word breastfeeding, and they had already now taken away my option as far as I was concerned. They never asked me, did I want to breastfeed? They never told me what the medication they gave me was for, and they took such an important choice away without any regard to my plans or my lack of understanding and the benefits that I could have gotten from breastfeeding and my baby. So I guess they thought they knew what was best for us at that time. That was quite a few years ago. But there are many lessons to be learned from that, and as a provider now, oh my God, I can't imagine even doing that, but that was my experience.
Absolutely, it's amazing. Shamiesha, can you speak in your experience, why is it necessary to have these conversations as Black women and Black mothers to talk about breastfeeding?
Because the thing is, if I'm being honest, it just hits different when it comes from someone who looks like you. Someone who can speak your language, who knows your experience, who can guide you and say, you know what, you may not have seen too many people breastfeed, but I'm here to walk you through it. And it just makes you feel like someone cares about you, like you feel seen. My experience was, like I said, I live in a predominantly white county in Orange County, California. And I was adamant about breastfeeding. I told everybody, I'm going to breastfeed and it is what it is. But when I got up to the mother baby unit, the nurse was anything but supportive. My baby was about, 2 hours old. She wasn't really latching yet. And I didn't know what I was doing. I didn't take any prenatal lactation classes. And my first time mom, and instead of walking me through anything, explaining anything, she came in and she put a bottle of formula on the counter and she left. And that was my first introduction. And so I was like, you know what? I'm not going to be that mom and say, oh, well, I'm not going to give my baby formula. And she's screaming. I didn't know, I didn't know much, but I knew the hunger cry very quickly. So I gave it to her. And then she came back 30 minutes later and said, oh, you gave her too much. Well, ma'am, there were no instructions. You didn't give me any instructions. So I could only do what you taught me. So the nurse the next morning came in and she turned my entire experience around. She got the lactation consultant in the room. She sat down on the bed with me. She was so gentle and patient and said, here, this is how you do it. And came full circle because now I'm doing my mentorship hours at that same hospital on the same unit. So it's like I get to help moms in a different way in the way I was treated. So everything's just coming full circle. So I'm grateful to be back there to be able to show them a different way.
Yeah. Wonderful. So let's really get to it. So Dr. J, you alluded to this, that breastfeeding has really important health benefits. Absolutely. And let's start with the benefits to the birthing parent. Why is it important that the birthing parent breastfeed?
There are so many benefits to the mom or the birthing parent. And basically, the first one I'll say is the release of oxytocin when the baby suckles at the breast. And oxytocin helps the uterus to contract. So right after the baby's born and the placenta is delivered, it helps the uterus contract, which decreases the amount of bleeding that mom has. So that is like the first thing. As a midwife, I want you to be under control. I want you to do it naturally without us having to give you a million extra uterotonics to try to get that under control. So breastfeeding does that. If the placenta is still in, breastfeeding helps it to release and be delivered. Another thing that it does for moms that is excellent is that it reduces the amount of postpartum depression. It also promotes bonding. That baby we do skin to skin, so that baby on the chest is promoting bonding. And it also decreases the risk of developing ovarian and breast cancer in the future. And that's a big thing. When we tell patients that, they're very surprised. They don't hear that much. Also, it helps burn extra calories per day. So it helps them return to their pre-pregnant weight a little sooner than normal. So those are some of the benefits of breastfeeding for the mother or the birthing person.
That's really incredible. I can speak to the cramping. I don't know for the two of you, that feeling it's like you're feeling the nurse and then you're feeling like this pull from the inside too.
Yes.
Such a bizarre, pregnancy and birth are filled with bizarre feelings, but that was probably in the top 10.
Yeah.
I think these are said very often, but the benefits for babies. So my husband likes to joke that between my twins nursing forever and we nursed after I had my COVID vaccine, that they are like indestructible. But let's talk about what are the health benefits for baby.
Well, I like that. I like that a lot, actually. I have noticed my daughter, we nursed until the month after her second birthday. That was not the plan, but that was, I feel like we would still be nursing today if I didn't say, okay, that's enough. And she's 4. it decreases your risk for SIDS, sudden infant death syndrome, lower risk of allergies, asthma, diabetes, ear infections, respiratory infections. And then overall, it creates the bonding with your mother. It's like when you've heard this heartbeat for 9 months, and then you get to see this person every day, it releases oxytocin for the mother as well as the baby.
Exactly.
When you are breastfeeding this person that you carried and they look at you, it's just, you feel all the love. So it's like, you can't even describe that feeling. It's hard to describe, but when you are going through that, there's nothing better than that, to know that you are literally sustaining this person's life.
Yeah.
Yeah. I can say as a twin mom, what was really special for me in terms of the bond with both of them was I very rarely tandem nursed or nursed the two of them at the same time, which is, I think, rare for twin moms. A lot of them like the efficiency of it. I really liked that I had, 5-10 minutes with each of them directly one-on-one every couple of hours. And that was a really just special moment for me.
Mm-hmm.
This is something I feel like there's not a lot of research on, or I haven't seen a lot of research on. It's benefits for the family. So I will speak first and say number one for us was costs. Twins are expensive. I can't imagine having to buy formula for them for a year or two. Have either of you seen other discussion of benefits for the family unit?
Yeah, cost is number one.
Yeah.
That's number one. That's number one. You do have still some costs where, you buy, bottles if you go to work and things like that, but you do dramatically drop your costs. But at the same time, you're reducing the times you have to go to the doctor because you have a sick baby. Now, breastfed babies get sick too, but not as often.
Right. The other thing I think is very important, I had a friend that I was so jealous after I had my son, because I had a good girlfriend who delivered about a month, after me. And we would be together with the babies. We would be out and she would have to come home. I would have to come home because I would run out of bottles. But she could, if we were out somewhere, she could breastfeed anywhere, the right temperature, no problem. And I can remember going to like drugstores in the snow, trying to find formula and, that kind of thing. And she never had to do any of that. And, it was, and then her husband used to help her by just bringing the baby to the bed. She didn't even have to get up. She didn't have to sterilize bottles. It was like a long list. I was so jealous, I have to tell you, and I don't know if now if somebody had talked to me then that I could have reestablished the milk, after that injection, but the lady just told me that it was gone. So I never knew about trying to maybe let the baby suck. So I never even went there. And I was jealous every day that I saw my girlfriend, every day.
Oh man. And you know what? It's so important to have that support team around you, your friends, your family. I would go out to like brunch or something with my friends. My daughter's maybe like 4 or 5 months old, and I would try to like cover her up and nurse. My friend was like, "No, what are you doing? Take that blanket off her head. Let her eat." It was like, "Do you eat with the blanket over your head?" I was like, "You're right." And that just brought the ease. It's like, okay, I had people around. She's like, "No, if you are comfortable with it, then forget everybody else. These are your boobs. Don't worry about what everybody else is thinking." So it was helpful to have those type of people around me to say, "You know what, you're doing the right thing. Forget whatever he has to say."
Exactly.
Yeah.
So let's talk about getting started with breastfeeding. And we did have one question about prenatal lactation classes. So I definitely took one and it made all the difference for me. I was delivered at a baby-friendly hospital, but I had preeclampsia and my blood pressure wasn't stabilizing. So I knew from going through that class to advocate, like I need the babies, I need my skin to skin time, I need to at least try something. And then I knew from talking to that lactation consultant to demand the hospital pump because I had twins right away. Shamiesha, especially, what benefits do you see to parents, and why do you recommend taking prenatal lactation classes?
Well, first, you don't want to be like me and scroll through Yelp at 2:00 in the morning looking for help. You're looking for a lactation consultant that will see you in the morning. You don't want to be trying to figure out, okay, why is he latching every 20 minutes? Why this, why that? That's why it's so important to be prepared. We take childbirth classes, we take all these other classes. Why not be prepared? See, just because it's natural does not mean it happens naturally.
Exactly.
Breastfeeding is a skill. It is a skill. It is a learned skill. And I commend anybody who even tries, because it's not easy. It's not an easy task. It takes a lot of determination and will, because when you don't know what you don't know, then you struggle, and sometimes unnecessarily. And you'll have those challenges. Your baby's going through a growth spurt. Your baby's, having all these sleep regressions and all these things. But if you take a class and okay, oh, that's what she was talking about. Oh,
They're cluster feeding because they're getting my body ready for them to grow.
And the biggest thing I always hear from moms is, oh, I don't have enough milk because she's on my breast every 45 minutes. I said, no, you do have enough milk. How old is she? Oh, she's 6 weeks. That's a growth spurt. Don't worry about that. You're good. But, when you don't know, you just think, oh, well, I must be making less milk. That's why I tell everyone, take a lactation class. It is so important. It will save you so much time and energy to be prepared than to chase after, trying to figure out the information when you could already prepare yourself prior to. So, look, take one like mine. So, just plug that out there. but I encourage all parents, and I'm big on support teams. Whoever your support system is, I encourage them to take the class with you.
Yeah.
So that way they learn while you're learning. So if you might forget something, because you will forget, because mom brain is very real, your support person can be like, oh, well, that's what she said. That's what she said. So that's why I encourage everyone to take one. Mm-hmm. Yeah. And the thing is, another thing, some people say they can't afford it. Well, you can come at that when you're having these baby showers and people are buying you 1,000 onesies. Have somebody just, start a little fund, put some of that onesie money into storing a little money for your lactation consultant, for your midwife, for your doula. That way, when it's time, you have some money available.
Exactly.
And you're right about finding support. The thing that I really loved was it's when I was having the issues in the hospital and didn't feel heard. And in a minute, I'll talk about when the lactation consultant at the hospital finally showed up and how unhelpful she was. I was able to email the person who taught my class and say, okay, I have my twins. I don't know if you remember me, but help, what should I do? And probably 2 hours later, she'd email me back, give me detailed instructions of what to do while I was still in hospital, what to do while I was home, when I got home. And we had her scheduled to come. I came home on Saturday. She was there Monday morning. And ready to do a weighted feed with me and make sure that I was set and latched and knew how to get an even better start. How else do you find that support? So Shamiesha, you've talked about your friend who says, feed your baby. You've talked about the importance of having your support network come to the prenatal lactation class with you. What other support systems should new parents have lined up to succeed with breastfeeding?
So I have a couple of slides that what I'll do towards the end, I'll put them up. That way people can kind of take pictures and things like that. But there are so many amazing support groups on Facebook. There's breastfeeding support for Black moms. That's the group that helped me through. Now mind you, it's run by lactation consultants, so they're very technical. Like and it's like over 160 something thousand people in there. So I'm sure whatever question you have, somebody has already asked it 1,000 times. So if you go in, search the group, you can find out how to go back to work. What do you need in order to go back to work? They'll even down to how to calculate it. Like they give you all the resources. There's also a dad's breastfeeding group connected to that group. There is, I mean, when I tell you there are so many resources out there, I went to a La Leche League meeting, and a lot of people rave about La Leche League, but me personally, I didn't feel the love. It could have been because I was the only brown person in the room, could be. But I never went back because I didn't feel that community. So it's very important to find those resources. There's The Big Latch. That's an amazing book. There is, I think it's called The Guide to, it's written by the founder of Black Moms blog. There's also Dr. J's fourth trimester transitional journal. There are all kinds of resources. Like I said, at the end, I'll post all of those on 2 slides. That way you can take pictures and you can, use them for yourself. But there are a lot of resources out there. One really great resource is KellyMom, kellymom.com. It's also run by lactation consultants, and they give evidence-based resources for any kind of lactation issue you can come up with. So there's resources. You just have to know where to look. Don't go to Google. Don't do that. Don't do that because you will get all kinds of information. It's always conflicted. Mm-hmm. So find the credible resources first.
Yeah, they're very important. Dr. J, can you talk, what questions should parents be asking? What should they do before they deliver and talk to their clinicians or medical provider about to get the best start in breastfeeding?
What I recommend during prenatal care, I start talking about breastfeeding from the first day. They ask them, are they planning to breastfeed? Do they know about breastfeeding? And most of my patients now are saying, yes, they want to breastfeed. Some of them will say they want to breast and bottle feed. And so we have a conversation from that first visit, and it kind of keeps going through the whole pregnancy. What I love is when they bring a family member or their partner to the visits. And even if we've talked about something, I try to make sure I revisit it on the day that they're there so that they hear, because that is one of the biggest impediments I find after delivery. If that mom hasn't taken a breastfeeding course or something, is the mom will be, ready and able to breastfeed, and it'll be a family member who will say, you don't have enough milk, that baby's crying, get a bottle, that feed my baby, that kind of thing. And it's very hard for the new mom because she wants to breastfeed, but you have either a mother, a grandmother, aunt, or somebody else saying, see, you don't have any milk yet, your milk didn't come in, that kind of thing. So if we can get them more involved during the prenatal period so that they start to hear the same thing that mom is hearing, that's very helpful. We also try to get the breast pumps. Insurance companies are paying for breast pumps. So I try to get that ordered so it's delivered to the house already. When the mom goes home with the new baby, she already has that breast pump there. But like I always tell them, that breast pump is there, but the best place for that baby is on the breast, unless you're gonna just stock milk or you're going back to work. But, especially to get the milk supply to start, the baby on the breast is the best.
And so one last question about kind of planning to breastfeed and being ready before the baby's here. What supplies and equipment should mom have at home? So Dr. J, you talked about the pump. Mm-hmm. I'm going to say for myself, something I didn't know about and wasn't prepared for was nipple pads, and lots of them. They come in boxes of 300 for a reason. Yes. You can use the rewashable ones too, but they come in that amount because you will need them, all of them. What else should moms have ready?
Yeah. Right. Those hydrogel pads, they're amazing. They're amazing. Now either use one or the other. As far as like the creams, you can either use the hydrogel pad or the cream, but not both at the same time because they both do the same job. Mm-hmm. I always tell clients to create a nursing station. So let's say get a basket or maybe something on wheels. Put your diapers, your wipes, your phone, your charger, water, snacks, whatever you're going to need, and pick a spot wherever you're going to be most comfortable, wherever you plan to be most of the day. That's why I say get something on wheels. So if you need to go from room to room, just take it with you. Instead of say, hey, bring me a diaper, do this, do that, because your job is to nurse and rest. That's your job. So if you're having to move all over the place, you're defeating the purpose, especially if you had a C-section. Who wants to be trying to get up and you need to rest? So that's one thing I say, create a little, make things as easy as possible for yourself. Get a postpartum doula. Get it. And the thing is, a lot of people say, oh, I can't afford it. There's a lot of programs now. Yeah. Medicaid is moving to cover doula services. There are a lot of programs that offer free doulas. They're out there. Yeah, they're out there. So you just have to look in your specific area. So those are the things I would say, just have with you. Make sure you drink your water. That's crucial.
Yeah, lots of water. If you do big water jug, or if you have, you do plastic bottles, just have lots of water. So let's talk about when you're at the hospital. So Dr. J, you've spoke about this a little bit. That feeling of, when does my real milk come in, or what is colostrum? Can you speak about that briefly?
Yes, colostrum is the form milk, and it comes in a very small amount, but it's very high in nutrients, and it has antibodies in it, and it's a small amount, but it is at the forefront of the milk duct. So the baby has to suck that, and as the baby suckles, the real milk comes in behind it. And what they have to realize is the baby's stomach is the size of a marble, okay? And so they only need a little bit. So I always tell my moms, it's all day buffet the first couple of days. That's what I call it. I said, the baby can be on the breast, they doze off in the middle of feeding, and then you get ready to put them down, and they wake again, and they want to go back on the breast. I said, that is nature's way of letting the baby get back on the breast and continue to suck. The sucking basically starts the engine of the milk supply, okay? And so the more the baby's sucking, the quicker the milk is gonna come in. But in the meantime, that colostrum is enough to nourish that baby.
Right. So I mentioned that I have twins, and the thing that I was told in my prenatal class, and I think she had told all of the other moms, you don't need to pump when you're at the hospital. You don't need to bring your pump to the hospital. You don't need to ask for a pump. But then she said, but you, the twins, yes, you do. So is there anything else special that moms of preemies or moms of multiples should do when they're in the hospital to make sure that they're set for success?
Absolutely.
Yes.
Number one, your baby is separated from you. So let's say your baby is in the NICU. You're going to start pumping right away because your baby is going to need that. And since your baby is not able to latch to you, let's say your baby is on the ventilator, your baby can't latch to you. So it's going to be important to you to pump right away. And in the hospital, we have, most hospitals use Medela pumps. They're hospital grade Medela pumps, and they have preemie setting and regular setting. So we always have our moms use preemie setting automatically. Drink your water as much as possible. We talk about hand expression, really, really important. Your hand expression is going to be key, because a lot of times with that pump, day 1, day 2, you're not getting anything but drops, and you're disappointed, and you feel anxiety because you're not getting anything out. But when you start using the hand expression, and I'll usually give them either a spoon or a medicine cup, and they'll put it right in there. We'll get a little small syringe, and we'll walk that over to the NICU. Even if it's a half an ounce, doesn't matter. It's the fact that baby can just taste a little bit of mommy's milk. So
can we talk a minute about the hand expressions? That was my fun moment in the hospital. So we the protocol at the hospital that I delivered at was, you saw the lactation consultant on day 2. So I delivered at 9 p.m. on Tuesday, and they had not put me on the list to see the lactation consultant until Wednesday. Now, Shamiesha and Dr. J know my mom, so you know that did not fly with her, and she was with us. And I was equipped for my class, so I'd been, as soon as I was in recovery after the C-section, advocating, let's try, what should we do? I finally saw a lactation consultant at 6 p.m. on Wednesday. after, so not quite 24 hours later, but before they were going to schedule me, because I wasn't going to see her until Thursday. And her recommendation was like, oh, you don't need a pump yet. And I'm like, but I have twins. I thought I was supposed to. Just do the hand expression. And in front of my mother, she started trying to teach my husband how to do the hand expression on me.
Okay.
That was an awkward moment.
Wow. I'm sure. I'm sure.
Like, that's how we got here in the first place.
I guess my question in all of that is, what kind of advocacy should moms be prepared to do? So I could say from my experience, she should be prepared to do a lot of self-advocacy. But from your experience, what other things should mom be ready to say and get done for herself?
Well, the thing is, like, let's say if your baby is, if your baby is in the NICU, it is great to pump right away, but it's also great to hand express. So like I said, we go see our moms usually no less than maybe 6, maybe 8 hours, max 12 hours postpartum. We're not waiting day 2. No, absolutely not. Because I've seen moms and they just delivered and there's already colostrum coming out right away. Like if we have the availability and the time, we're going to see you the same day you come up to the mother baby unit. That's just what it is. But it's important to say, oh, okay, this is what I want to do, and to make the nursing staff aware of what you want to do and advocate for yourself. If they're saying, well, we don't have a lactation consultant right now, okay, what nurse do you have on staff that is a lactation educator? Because they should always have one. The hospital that I'm at currently, majority of the nurses are lactation educators. There are some that are also lactation consultants.
Exactly.
So you should be asking. A lot of people don't know that, but you go to some hospitals that none of their nursing staff has any lactation training, which is ridiculous. Yeah. I feel like all mother baby nurses, all L&D nurses need to have some kind of training in lactation. It's important. But if, like I said, if the lactation consultant is not available, ask for whoever the lactation nurse is on call, who's working today. There should be at least one minimum. But it's a matter of speaking up and knowing those things. Most people don't know that. They don't know. So that's why it's important in the beginning, take those lactation classes, because those are the type of things we talk about in those classes too.
Right. I was going to say, my institution is a baby-friendly institution. So many of the midwives and the nurses on L&D and postpartum are lactation consultants. We even have some IBCLCs there. So that first hour, that golden hour after delivery, every mother is encouraged to breastfeed, and someone is in that room with her helping her breastfeed. So the majority of our moms latch right in, after during the skin to skin, they latch at that point, and then if they need the hospital lactation consultant, then we get her in. But many moms are comfortable, and the nurses should be assisting, And what I find when I make rounds is sometimes it just takes somebody sitting with the mom just for a few minutes and helping her get comfortable, because I've seen such crazy positions that moms are in. And I say, if you're not comfortable, the baby's not going to be comfortable. So you have to get a comfortable position, that extra pillow, make sure that mom is comfortable, set her up, and then help her get the baby latched on. And sometimes it's just that little simple thing that makes the difference between her giving up or not. And most of the time it's mother saying, my nipples are sore. And it's like the baby's not latching. They're not latching on the end of the nipple. They're not up on the areola. And to show them how to do that, They say the baby keeps crying. I said, that's great, because then they're going to open their mouth and then they're going to latch. Okay. So I always teach it this way. I say, this is the nipple here. I said, if the baby comes on the actual nipple and sucks, break the seal, take them off immediately. I said, you're the boss. It only takes a little while for that nipple to get cracked and painful. Then you don't want the baby near you. I said, when they cry, they open their mouth and then they go and you push the breast in. Now they're up higher. I said, look where the nipple is. It's not touching anything. Now, you know, the baby is not touching the nipple now. They're up on the areola. You're like, oh, okay. So those little things, you know, just to sit there with the mom and to help her and to make sure that she's asking the questions and feels comfortable, you know, starting to breastfeed. And if she's having other difficulties, absolutely get someone else in there to help.
Absolutely. A lot of times it's a matter of, usually it's just a matter of positioning. Like you said, it's a matter of, okay, you're in the wrong position for your breast, for your baby. Let's try the football hold. Let's get some more pillows in here. I believe in pillows. I believe you need to have more pillows and you need to have as many pillows as you need. And I always ask, do you have a breastfeeding pillow at home? If they say no, I said, okay, bed pillows work just the same. You just need to stack them. But it's a matter of making, like she said, making sure that baby opens wide. I always say, flick this is your nipple, flick till they open real big, like they're crying, and they literally mush it into it. Mush it. That's what mush their face into it. That's what I talk about. We have a question. Can we talk about flat or inverted nipples? Yeah, that's a common thing. Sometimes in the hospital, nurses are very quick to give nipple shields. And nipple shields are a great tool when used correctly. There are so many devices now that you can use to bring the nipples out. There are all kinds of, you can use a breast pump for one, pump for a few minutes. A lot of times that'll bring the nipples out. If you don't have that type of time, stimulation, like hand stimulation of the nipples will usually evert them. Also, there are all kinds of sex toys. You know, clients love when I talk about that. You know, all kinds of sex toys that are used for nipples, those help too. So there are so many different ways. And a lot of times with when they're like extremely inverted, nipple shields do help with those type of things. But there's all types of tricks and ways. So it's just a matter of how they're shaped. So it's a case by case basis.
Let's shift to that and talking about some of the challenges. So I love to say that it was just hunky-dory, that we were great, but we had the rocky start in the hospital. And then my girl, when she figured out how to latch, she was good. So it took her about a week and then she was ready. My boy, it took 7 weeks. Ooh. And I think I would have been worried, except our LC had said, you need 3 to 4 weeks after their due date. And they were born at 37 weeks. So that he was right on schedule. He was like 6 weeks and 5 days. And then just one morning, we're trying to like get the pumped milk into a bottle for him. And he just starts bobbing his head like he was on a oil derrick. And it's like, oh, maybe he's ready. We got him on and he was ready to go. And then after that, we were set. Let's talk about kind of that perseverance to get through those couple of weeks. So what should moms be doing? What should they be trying? Who should they be calling? So we talked about, you know, I'm sure in the middle of the night, you're going to go to your Facebook group, the good Facebook groups.
Yeah.
You can call your lactation consultant. I talked to mine several times. One thing I did go to, I live in a neighborhood that has a lot of people of color, so I did find a good support group, and that was helpful. In doing weighted feeds. Can you talk about like what a weighted feed is and why they're like the greatest thing ever?
So basically we do them in the hospital too, but we do them a lot at like the mother baby assessment center. So let's say mom will come in and they really want to know how much milk they're transferring to the baby when they breastfeed. So we zero out the scale. We strip the baby down to nothing but a clean diaper. Mom breastfeeds. We put the baby on the scale. She breastfeeds. I'm sorry, wait, I got that backwards. We weigh the baby. She breastfeeds. We weigh again, and we do it in grams. So you can actually see how many, then you can convert it. You gave your baby this many ounces. You know, that puts so many parents at ease to say, wow, I actually did that, because that's the biggest worry, is my baby getting enough? That's the $1 million question, is my baby getting enough milk? And if you can actually see a number, because most people are visual. If I can see, okay, I gave my baby that much, then it just brings your ease. You know, it brings you so much ease to say, okay, I'm doing what needs to be done.
It did for us. We tried it at the beginning, and then even over time, as we were getting more comfortable. And we have a friend whose daughter is a year younger than my twins, and she was trying to feel good about it, but her mom was not pro breastfeeding. And her mom was saying, the baby's not getting enough, baby's not getting enough. And I said, oh, just try to find somebody to do a weighted feed. And don't you know, grandma was like, oh, okay. And that answered the question right away.
Yeah.
Dr. J, can you talk more about kind of what sort of things should moms be prepared to go through as they start breastfeeding, and when should she be worried and when is it normal?
Okay. At the beginning, when the milk first comes in, usually it's when the mom gets home. They just get home, and now the milk comes in, look, furiously, I'll call it. And that's when we call, when they are engorged, okay? And that's when both breasts get full of milk. It's painful, but it's equal. It's both sides, it's under the arm, and they wake up and they have like breasts that are hard, rock hard. That's a very normal thing that happens if it's on both breasts, and we tell them about that before they go home, so they're expecting it. Basically, what you want to do is get these breasts emptied of the milk. And so I always tell moms, when you're ready to feed your baby, one thing you can do is either put warm compresses on your breast, or get in the night, take your shower right before you're going to feed the baby, let the warm water go on your breast. You can start to hand express a little bit, because many times the breasts are so full that they're hard, and it's hard for the baby to latch. So if they can hand express a little bit and get the milk flowing, and then put the baby to the breast. In between, there's a lot of things that moms can do. One old-fashioned remedy that helps a lot is cabbage leaves. Tell them to buy a cabbage and put it in the refrigerator, and after they finish breastfeeding, they can take one leaf off and put it on the breast. It's very soothing to them. But the main thing is that they want to empty the breast, let the babies get the milk. So they're gonna, alternate breasts and make sure they feed on one side and the other side. That shouldn't last long, and that's a normal thing. It's very uncomfortable. Sometimes they could run a low-grade fever with that, which is very normal if you have the engorged breast. The thing that we want them to be concerned about is if it's one area that is like a reddened area that's painful in one area, that might be a clogged milk duct, which is called mastitis. If they have that, if they notice that, they should still feed the baby on that breast to help the milk duct unclog, but they should see their provider and be on antibiotics to make sure that infection is gone. That's an infection also.
Mm-hmm. What about tongue ties? Tongue ties and lip ties. I know they're
it's very controversial.
Everyone, if frequent question,
it's very controversial.
Everyone is certain that their child has one.
It's very, very controversial. The thing is, if you in the hospital, everybody say, oh, well, it looks like your baby may have one. But the thing is, if your child is able to get their tongue, if it thrusts out, because what we'll take a gloved hand and we'll kind of massage in the mouth and see what the baby suck pattern is like. That's one way to tell. And then another time we'll just lift the tongue up and see what it looks like under there. But if you latch your baby and it's extremely painful and it doesn't ease, even with adjustment, and you take the baby off and your nipple looks like a tube of lipstick, like the fresh lipstick, that's an indication that it's either a shallow latch or there may possibly be a tongue tie. The only person who can diagnose that really is a pediatric ENT, or you can see your pediatrician and they may be able to refer you. But there are some lactation consultants that specialize in tongue ties. Not everybody specializes in tongue ties, and don't let anybody tell you that they do if they don't. There are special certifications for it, but it's good to see if you're having this constant pain, my best friend, her son had a severe tongue tie, where so much so that she was pumping exclusively for 6 months before she got his tongue clipped. And then after that, they were exclusively breastfeeding. But it was to the point where she would be crying every time she tried to latch him. And it wasn't that she was doing anything wrong. It's just his tongue just did not go far enough that it need to. So if you feel like you have those type of issues, reach out to a pediatric ENT doctor or reach out to your child's pediatrician and let them refer you. It's really important, but not every lactation consultant can handle tongue ties.
So we're at 7:20 almost. If you have questions, please put them in the chat or in the Q&A. We'll keep chatting and then we'll jump to your questions as they come in. Let's talk briefly about nursing or pumping away from home. So I know that one of the top 4 reasons that a mom stops breastfeeding is because she goes back to work. So first, let's establish your rights. You have the right to nurse, to pump rather, during the day. And your employer has an obligation to provide you with a space to pump.
Yes.
So that is number one, the first thing to talk about, and the first most important thing to know. What else should moms do to be ready to go back to work and still continue nursing and breastfeeding?
Well, for one, get your pump supplies together. Make sure you have your pump. Make sure you have your pump bra. I always recommend everybody get a pump bra. If you can't afford a pump bra, get an old sports bra, put it on, and that's a homemade pump bra, free of charge. Take your bottles, your little cooler, or whatever you're going to keep your pumped milk in. Bring what else do you need in there? Bring a little small thing of soap to be able to wash it. What else do you need?
Expensive, but Medela does have, and DAP will have some wipes too. If you don't have access to water and it would be easier, some wipes to be able to wipe your pump parts.
And then you can also put them in the refrigerator. If you want to wait till the end of the day to wash them, you can put them in the refrigerator and that'll kind of keep them, condensed. But yeah, those are the things. Don't forget your bag. I have had to hand express at work because I forgot my whole pump bag. At work, I had to hand express it to a specimen cup. Okay. I had to do it. So it was either that or be in pain for 12 hours. So that was what was necessary. But it's just a matter of making sure you're prepared. So pack your things the night before. If you know you're going to be away from your baby for 8 hours, depending on how many ounces your baby is taking in, then there's different breastfeeding calculators to figure out how many ounces you need to have, how many bottles you need to be having. But when you do pump, let's say you want to put them in individual bags, it's important to lay them flat in the freezer when you get them home. Put the date and how many ounces. That's crucial. If you don't put the number of ounces, when you open it up, it's going to be filled all the way to the top. So it'll look like 6 ounces, but it's only 3. So it's really, really important to put how many ounces and use the oldest milk first.
And then you spoke briefly about this, Shamiesha, as well. If you're out and about, so your friend gave you the comfort to take the blanket off. I also want to say, mom's rights. If you're allowed to be there, you're allowed to breastfeed there. Even if your nipple ends up showing, even if your whole boob is out, it doesn't matter. If you have the right to be there, you have the right to breastfeed there. That's so important. I know not everyone's comfortable with it. I feel like after, pregnancy and delivery, I could be naked and I probably wouldn't even notice. Because I've been naked in front of everybody, it felt like. But that's really important for moms to see. So we do have one question about weighted feedings, and I want to make sure that we talked about all of the other ways that moms can know that baby's getting enough. So we talked about weighted feedings, but one of the other things I remember learning is counting diapers. And are there any other tricks? or not tricks, but methods for parents to feel some security?
So let's say the rule is for the first week, you need at least 1 pee, 1 poop per day of life. So day 1, 1 pee, 1 poop. Day 2, 2 pees, 2 poops, and so on and so forth. That's going to be your first indication that baby is getting enough. If like I said, like you said, if your baby is always having wet diapers, they're getting that fluid from somewhere. So, you know, it's tedious to constantly do weighted feedings. It's tedious and it will get old quickly, trust me. That's not something you want to have to do constantly. You have to learn to trust your own instincts as well. If you're not sure, reach out to a professional. But trying to do weighted feedings all the time to keep up with baby's weight is a task in itself. You're already sleep deprived. You're already hungry all the time. You're thirsty all the time. And then have to worry about, you know, scale 2. It's just one extra thing that you don't want to have to deal with. So the biggest indicator is pees and poops. That's going to be your biggest indicator. If the baby's poop is a yellowish mustard color pretty consistently, that's how you know they're getting what they need. Exclusively breastfed babies, their poop, I know we're talking about poop, but it is what it is. It's usually like a mustard color, usually. Yeah. So when you see that, okay, I'm doing something right.
And then breastfeeding and sleep training. I know those are two things that don't always go together. So our pediatrician, their practice is very pro sleep training. So at your 2-month appointment, that is one of the first things that they say to you is, okay, if your baby's gaining weight and they're comfortable with your baby's weight, they're like, okay, you can start thinking about sleep training. How can parents feel comfortable doing that transition? Assuming that is the choice that parents have made. But I know it's a controversial topic.
What do you think about that, Dr. J?
My child is old, okay? So we used to just put babies down, and if they woke up to be fed, they were fed, you know? We didn't wake them up. My son was bottle fed. So when he woke up and he was hungry, then I fed him. But I think after a month, he slept for 4 or 5 hours at a time. And then he would, you know, wake up and just eat and go back to sleep. So I really can't speak a lot to that. I just think that when babies are small, they let their needs be known by, you know, crying. That's their communication. And that we need to respond to their communication with us. And they need to feel safe and heard too. They're little people, but they need to feel comforted and not, you know, I kind of have a hard time with people just saying, don't pick the baby up and, you know, you're going to spoil the baby. No, the baby needs to be spoiled. You can spoil them good, but you know, I think babies need to be, you need to attend to your child when they have needs, and that's the only way that they can respond to let us know that they need something.
I agree. They don't have any other way to communicate with you.
Exactly.
So if they are waking up in the middle of the night every 3-4 hours, that's because that's their body's way of waking up and say, I need something from you. I need comfort. I need love. I need to see you. I need to smell you, touch you. Right. So they have a need that you're trying to fulfill. Babies are not meant to sleep all night long. Right. Especially a newborn. That's not physiological. That's not what they're meant to do. Right. And they're meant to wake up. It's just their body's way of saying, hey, wake up, don't get into that deep sleep. You need to wake up and eat. Right. They're supposed to eat every 3 to 4 hours. That's what they're supposed to do. Every 2 to 3 hours, actually, as a newborn. So, you know, I get that parents want their sleep, but you have to also remember that these tiny people are depending on you to feed them as often as they need. Mm-hmm. So it's really gonna depend on each baby is different. You can't give a blanket statement for every baby because every baby is not the same. Right. One sleep training program may not work for your baby. It may not. I personally didn't sleep train my daughter. When she woke up, I fed her and I put her back to sleep. Mm-hmm. So, you know, and then when I woke up and I got 5-6 hours at a time, I'm looking like, is she okay? What's going on? I can't believe you slept that long. So, you know, it's just a matter of personal preference and personal choice. But I know, you know, when you're going into this new parenting thing, you can make so many plans and plans can change in an instant. So you have to learn how to roll with the ebbs and flows of parenthood, because
Right.
it's changing. It's fluid. Parenthood is fluid. It changes all the time. My plans may not have been my daughter's plan. I did not plan to breastfeed for 2 years. Telling you, I did not. My plan was 1 year. She had completely different plans and I just rolled with it. So you have to go with what your child's needs are and follow your own needs, of course, but their needs, they're dependent on you 100%. So you have to attend to their needs first. Oh, you're on mute, Grace.
This is where having your village and having support is really important. So my mom was able to be with us for the first 6 weeks, and then my mother-in-law was with us for the 4 weeks following that, or 4 weeks after that. So we had a lot of great support. So we did the same thing. I could sleep. At the beginning, since I was pumping more, I'd wake up in 3-4 hours, pump, go back to sleep, and they did all of the night feedings, and it was such a blessing. I just didn't have to worry about it, and we were able to do it. So, you know, having a baby is a team sport. It's a big team sport. You need like a basketball team. So if you can have your spouse bring the baby to you in the middle of the night, if you can, you know, get one of the bassinets, we didn't have space for it, be able to roll over, nurse, go back to sleep. That can really make a difference and be able to delay needing to sleep train. I also have twins, and we did sleep train. And I know that at some point you just need them to sleep. It's important, but they're going to do it when they're good and ready.
When they're good and ready. And that's the thing. We think we can train them, but in the meantime, we're the one being trained. Like, listen, you're not on my schedule, I'm on your schedule. And that's the thing. That's the thing that parents have to remember. We can try to train them as much as we want, but your baby was born with their personality, and it's gonna show through. So if you have a strong-willed child, you have a strong-willed child, whether they're a newborn or not, it's gonna come out.
Yeah. They're the boss.
Yeah.
So I know we're at 7:30. Are there any last questions before we wrap up? Not seeing any. Do you feel like there's a script that I was supposed to say?
Oh, the giveaway.
Yes. Okay, so I'm going to find where my instructions are for that. Shamiesha, I know you mentioned that you have some resources. Do you want to put your slides up?
I sure can. Let me, yep. Give me 1 second. Let me make sure it's up and ready. Yeah, hold on, let me share my screen so you all can take a picture. Hold on. Oh, it said host disabled participant screen sharing. Hold on. Okay, there it is. Let's see if it'll do it now. Do you see my screen? Can you see my screen? Okay. Hold on 1 second. Sorry, let me make it bigger so you can see.
Yes, I can see it.
Okay, so here are, if it'll get bigger. Come on, computer. Well, why doesn't I want to present? There we go. Uh-oh. I don't know what is going on with, okay, sorry.
I've been presenting, can you hear me?
Yes,
Mhm.
Chrissy, yeah.
Weird.
When press autoplay, but we can also, if you want, we can send these out to the guests after as well.
But it's a part of a whole presentation.
Oh, okay.
That's the thing. Hold on. Let me see if I could just, there it is. Okay. So here are, let me move this out the way. Here are 4 books. So if everyone wants to like take a picture, these are really 4 great books. The one on the far left, that's Dr. J's Transitions for 4th Trimester Journal. That's specifically for Black moms. Oh Sis, You're Pregnant, that's a really great one. Has compilations from different lactation consultants, doulas, all kinds of different people contributed to that book. The Big Letdown is the author, she is the person who started Black Breastfeeding Week. So these are some really great resources to have. And then, let's see if it'll go. These are some really great Facebook groups. Melanin Moms of Orange County, that's my Facebook group specifically for Black moms in Orange County. We have Black Moms Breastfeeding Uncensored. That's a really amazing breastfeeding group where you can ask a lot of good questions and create a good community. Daddy Can Do, that's a really great resource for dads of breastfeeding babies, and the breastfeeding support group for Black moms that has some amazing resources in it. So those are my online favorite resources as far as breastfeeding goes for Black moms.
Thank you.
Make sure you take a picture.
I found my wrap up script, so I just wanted to share that there have been 2 raffles that have been running all week. Maybe you didn't know about it. So the first is from a great company called And Out Come the Boobs. They make the best fun nursing shirts. They make custom t-shirts. I have one that I sent to them. That's a t-shirt from a Lizzo concert that I went to when I was 7 months pregnant. And they put a zipper across the middle right here, and it allows me to feel cool and still felt like myself, and still be able to easily nurse. Second is, and so they have donated a $50 gift certificate. The second raffle item is from The Little Bee. It's a baby gift subscription company, and they have provided a complimentary gift box. The winners for these raffles have been drawn from the registrants from the last 4 days and will be notified by email. Last, we want to remind you to take advantage of a 20% discount that's been provided by Ade and Aya, a curated collection of beautifully crafted items that make the African aesthetics practical and affordable for your little ones. My twins spend a lot of time in Ade and Aya. It's beautiful. And I believe the discount code for that is BTM for Birthing the Magic 20. BTM 20. So finally, I want to thank Dr. J and Shamiesha for joining me here today to have this great conversation about breastfeeding. It almost makes me miss it. It wasn't that long ago for me. They're only 28 months. Thank you both for joining me, and also want to thank all of the speakers and moderators and organizations that collaborated with the Birthing the Magic team to bring this vision to fruition. And I want to give a special shout out for one of the women behind the scenes, who is my mother, Marie Boone Clark. And she didn't want to be on screen, but she has been working to make this week come together. She is a dedicated advocate for Black women and Black women's babies. And so thank you, Mom, for making this week happen. So thank you, ladies. Thank you, everyone, for joining today's event. And we will hopefully see you before next year, but everyone be well.
All right. Bye, everyone.